Cliff Kelly, and who's joining us in the call is Adelina Marshall, a VA employee and mental health RN for over 30 years.
Yeah,
she must have
she's going
started
to
when
give
she was
us a lot of help.
5 years old.
That of course, is Colonel Dr. Damon Arnold, and our executive producer, of course, is Glenda Smith.
Yes.
Our digital media producer is Manny Corazari, and our assistant digital media producer is Titus Williams. And of course, with Dr. Arnold, we have a good time.
Yes.
And getting a lot of. Did you hear that last gentleman say he'll come out to the house and check your thermostat out?
Oh yeah, that sounds perfect to me.
I hope you didn't miss that. I got it for you if you did. I make sure I take care of my buddy. You know. So.
Well, but Cliff, one of the things is that the disparity in healthcare due to racism is really a big issue now, and in a national spotlight with all of the protests going on and everything else, it's really important for us to start thinking about the healthcare, especially with the COVID-19 is uncovering a lot of things. And Adelina, has been dealing with mental health for many years, and has probably seen all the issues surrounding PTSD and our veterans.
Right.
So Adelina, tell us about this. What is
go
the
right
issue
ahead.
surrounding racism?
So COVID-19, as you stated, really highlighted this concern, as the minority nurses have known all along, public health nurses have known all along, and as well as being a mental health nurse, I also have experience in med-surg and ICU. The information that I gathered from this program comes from the Journal of Professional Nursing, CDC, American College of Physicians, the Center for Medicare Advocacy, and American Bar Association. There are a lot of professionals who have identified this even many years ago, but due to COVID-19 we are now confronted with this. No health care should be tied to a job. Many of our people are losing their jobs now every day, and generally minorities are at the bottom of the poll with jobs, while many of us have gotten our jobs later or more junior on the workforce, and therefore once these jobs are lost, then our health care is lost, causing more problems. Mm-hmm. This disparity happens actually before conception, because without the optimal health of the mother, the child would be brought into this world at a disadvantage. That's due to poor housing, which is shelter, nutritional food, the exposure to pollution, such as smoking, drug use. Clean air is a problem, lead exposure, coal tar in our communities that are polluting our children's lungs and the lungs of the mother and other family members. Chronic disease, communicable disease, which COVID-19 is one, HIV, TB, Ebola, Zika, which has happened in black countries, and many other known and unknown. We need an increase in public health allocations so that we can have preventative measures in our community, and we've lost a lot of that due to funding cuts, and they need to bring that back.
Yeah. One thing, and you ought to be commended, VA employee and mental health RN for over 30 years. The disparity in health care is, I think you're saying, is due primarily to racism. Is that true?
It's due to racism, but it's not the primary reason for that disparity. Part of that disparity is coming from a lack of education. And in the VA, we do try to educate our vets and provide them with information they need to maintain optimal health. But as you know, when our Vietnam vets came back, they were denied some of this health care that is available to them today. The VA knows that, and the VA has done studies on racism within the VA. Some of the problems that we find with the bias in delivering this care to our patients is that the nurses, especially the minority nurses, are not heard. I have been on a unit, and the doctor thought that I was a health tech, even though I was in a white lab coat and clearly, had a name tag that identified me as an RN. So there are intentional bias and unintentional bias associated with healthcare. And many times this healthcare, we don't ask the questions. We don't have the education to know. We're fearful of what the test may show. So there are many things that lead to diversity problems in healthcare. However, racism is at the forefront, and it encompasses all of the above, housing, clean air, adequate food, and also, again, it's tied to jobs. Anybody, we're going to see this. They're talking about eviction, but they're not also addressing the healthcare needs that are going to come about because of COVID. You just don't get COVID and recover tomorrow. Some of the patients who have become infected with COVID, we had one at the VA for 4 months. It was just on the news. He was released after 4 months. So even though he was infected with COVID, it lingered. And if he have health care coverage, if he wasn't a vet, he may not have gotten that treatment that would have helped him to survive this exposure.
Yeah, one of the things that you're bringing up, it really is, it gets to pulls on my heartstrings sometimes. It's that sometimes, African American veterans, when they're coming forward, if they've been experienced sexual trauma, or if they have PTSD from combat experiences and those kind of things, it's sort of like there's an implicit bias that they're faking, or that they are trying to get over in the system, and the kinds of approaches to them and the diagnoses that are coming out aren't commensurate with what they actually are experiencing, and so that delays their treatment, or sometimes they don't even get treatment at all, and they end up. We have so many homeless veterans on the street who have mental health issues that they're just coming back from combat, those kinds of things. And, how can we really address this implicit bias as a veteran if we go in and we're being perceived in that way? What can we do to convey a story or tell people that this is something that's serious and you need to look at me as a combat veteran who defended this country?
Right. A combat veteran who experienced trauma now in the VA, they are admitted to the VA. Even if they did not qualify for services at the VA, we will treat them for military sexual trauma. What happens is many of them has not identified or won't come forward to indicate that this had occurred to them in the military. And myself, as a VA nurse, I'm really kind of shocked at the amount of veterans who have been exposed to military trauma. So this really needs to start in the service, that if these things happen, it needs to be charted so that these patients can show, or these veterans can show, that this has that history of being traumatized while they were in the military. So some of them don't even have records. But the VA now does accept that, and we do treat many of our veterans on the unit that I'm on for military sexual trauma.
Yeah.
However, again, they have to be believed. I mean, we take the stance now that if they tell us, then we do believe them, and we do help support that. But many of them think they won't be believed. The staff has to show them the compassion and the empathy of what has happened to them and encourage them to come in and to talk about it. Many times they don't want to talk about it because they don't have people who look like them who are treating them. So even doctors, the psychologists, the social workers, the nurses, we need more of staff that looks like the patients that we are treating. They feel more for seeing us, and they feel more comfortable in discussing these situations with us.
Yeah. And, what about the role of the family members and that kind of thing? How important is that, for the family to be involved in, the solution to some of the problems with PTSD and, their awareness and education on it?
So the family members are very, very important. We talked just even recently, a veteran was telling me the support he has from his family, but other veterans are cut off from their family members because the family doesn't understand what they've been through, what the body's reaction is to, what the mind's reaction is to this inconceivable act. And I think that the VA could do more of an outreach to family members and to the public, really, to have them to understand these patients and their reaction. That's why the VA is really the best place for our veterans to come to for care, because we do get a lot of training on PTSD and sexual trauma, more so, I would say, in the last few years than ever before. So it does show that the VA is recognizing this and that our veterans need to be treated for this.
Yeah, and,
I think you're absolutely right about that, and I think that they are doing better. And I think one of the great things, the reason I'm so happy to be involved in our program, is the fact that we are able to do some things that we hadn't done before, and that's because of people like Dr. Arnold. Dr. Arnold is Damon Arnold is not only a soldier, but he's a doctor. Mm-hmm. And when you see folks like that, it makes a big difference. We've made, I think, and I think, Doc, you'll agree with me that America's Heroes Group has a better relationship with the VA than it had some time ago, don't you think?
Oh, most definitely.
Yeah.
And the VA has evolved as well.
Right.
I remember when I first joined the military back in 1984. I was in the service for 26 years, and when I first joined, it was a completely different place. I was kind of almost shocked when I went back into the VA after seeing it during the time period when I was actually being educated, and at the University of Illinois. So I was going to the Jesse Brown VA, and at that point it was West Side VA. So I'm telling my age with that one. But that I think is really important, and you hit on a couple of really important issues. And one was, the need for these academic and educational institutions to give the opportunities to more people of color to get their degrees and to be trained and to become effective in mental health services. Right now, we have a severe shortage of psychiatrists and psychologists. We have even a shortage of social workers, who are reaching out to people in the community for mental health service provision. And we need to have more people in this field rather than less, and especially people of color who can actually address the population they're dealing with because of the cultural norms and perspectives that you were mentioning. And you also mentioned that this exposure to different things, like, we had a caller on before. His name was Darnell, and he actually is working with the ecosystem, and he was talking about lead exposure in the homes and how that can actually predispose you to some, mental health, cognitive impairments, and those kinds of things. So it's critically important to get the right diagnosis as well for our veterans to make sure that they're getting appropriate therapy and treatment for it. And one area that I really want you to talk about really quickly is the telemental health, what's going on right now. I'm not sure if that is something that's going on with the VA system, because with COVID-19 it's harder for people to come in to these systems, and whether that is playing any kind of role you see.
Yes, at the beginning of COVID, I was reassigned to work in telehealth. And actually, our veterans enjoyed that, and it kept them connected with their core treatment team, as well as those that have been in their treatment programs. So they enjoyed it. We need more of that. We're fighting right now to get more telehealth in our community care, programs. We do think we can do more of an outreach that way. We also had started offering injections that were a month to 3 months, and that kept the veterans out of the hospital and made sure that they were complying with their treatment program. So you're absolutely right. The telehealth is very, very important. We need more NPs, like you said, and doctors. And actually, programs such as the American Hero and you, Dr. Arnold, it is so important in our community for our veterans to have a voice and to be able to hear your advocacy for them.
Yes, and Cliff has been doing that for many years. He is a Vietnam veteran extraordinaire, and has been championing that cause for quite some time. And once you've been a veteran, you're always a veteran.
That's true.
And it's in your blood. And
so that's why I just love what Dr. Arnold does. He's just does a fantastic job. And as long as we can have people like you to come on and talk about it, it helps everybody. Because a lot of
to add something to that, even though I'm not a veteran, once you work with the veterans, you do have a total commitment to them. It's just hard to walk away, and as much as we kind of deal with staffing shortages and supply shortages, the staff who works at the VA is so dedicated to our veterans.
Listen, I've been to the VA, and some of these folks I see work so hard. It is so great to see what they do. And, you don't have to be a doctor to help sick people. So,
yes, right.
Yeah, exactly. So, I think that what our folks do is just great. The things that Dr. Arnold has done that I know personally in helping people. The one thing I think that we do at, as we have this, and the reason we do it, we are able to help people. We are able to get people to that folks wouldn't hear about otherwise.
Right. Right. It's important.
And many veterans work in the healthcare and at Jesse Brown, and even our EMS crew, the ones that are cleaning the hospital and keeping us all safe from COVID. A lot of them are veterans, and they help each other. They help to support each other there, and many of our nurses are veterans. So when the veterans come to the VA, they are being treated and heard by other veterans.
That's true. And in fact, one of the best talks I've ever made, in my opinion anyway, I hope the people that were listening agree, because I've been in politics and so forth for a long time, but I was able to make a talk. I was asked to make a talk at the VA, and it really. I saw so many people I knew. That's what just got me. You know what I mean? People that I knew didn't even know they were veterans. And we had this. They were there because they are veterans. But anyway, we had this great conversation afterwards, and as long as we can be supportive of each other. It's just a great thing, and I think we'll continue to improve.
Yeah, and I think you're absolutely right, Cliff. And as we're going down through this time period, especially now, where veterans are potentially locked in at home with the COVID-19, and with all these stresses going on with the the protests and everything else, and then what what's happening in government and everything, it becomes a lot more stress on some of the veterans who are out there. And I'm not sure if you're seeing an increase in the needs for mental health right now among our veterans during these really trying times. And I have a call-in number, 773-591-1690. Just for time for maybe one question if someone calls in. But maybe you can speak to that. Are you seeing an increase in the number of people seeking services right now?
We're starting to see more of an increase. I think in the beginning, veterans are very resilient, but now they are, I think the impact of knowing what this COVID is doing and the exposure, and when you can't get the buy-in into wearing the mask. And I'm thinking now, too, I hope some of the veterans who have been infected with COVID, if they would consider donating some of their plasma so that other veterans can survive this virus.
Yes.
But we do see it. And the one thing is, what I'm noticing with the telehealth, they do tune in and come in on time onto the radio, the telehealth calls, and they're happy to be there because it gives them a connection to other veterans, and they can do Zoom call. Many of them are keeping up with each other on Facebook and supporting each other. But we're there. Any of our vets who need us, our inpatient unit is pretty much at max.
Okay.
And we need them to come in. We want you there. Don't be afraid of COVID. If you need us, you come in, and we're going to take care of it.
Okay, we have time for one very, very quick question. Gloria, you're on the line?
Gloria, are you there?
Gloria?
Yes, I am.
Okay. Yeah, just one quick question.
Yes, I have a question. I have been following Adelina, and she's, I think, very informative as to the information she give out. I work in one of the DuPage County hospitals, one of the very larger hospitals, and I very seldom see veterans come through. And I do know, because of the area that we're in, I think people think it's a wealthy area, and we don't service vets. But what can we do to get those individuals into us so that we can give them the services in which we have to offer?
Okay.
You wanted to answer that, Adelina?
Okay.
We're running out of time. We have about 1 minute to go.
Private sector, we really would like for our patients to be stabilized and then come to the VA if they want to. If not, then private sector needs to do more training to be able to supply our veterans with the care that they need, especially in PTSD.
Yeah.
And you don't hear a lot of that going on in private sector. In the city, you do. But we need.
Doc, we're about out of time.
Yes, we are.
Doctor.
Yes. Yeah. Do you have a call-in number? A number they can call just really quickly if they need services, or any website they should go to?
So they can go to va.gov. They can go to. They can call Jesse Brown, which is